Welcome to the deep dive. Today, we're not just skimming the surface. We're really taking a deep dive into a specialized collection of C1 level health vocabulary.
Mm,
Our mission, well, it's to move beyond just the simple definitions. We want to truly grasp the subtle power, the specific context, and why these crucial terms really matter in your conversations, reading, even your professional life.
yeah,
Think of this as your express lane to being genuinely well-informed and confident.
that's absolutely it. For C1 level proficiency, especially in a field like health, you really need to engage in nuanced, sophisticated discussions, across medical, wellness, psychological domains.
Right.
This deep dive offers that shortcut, providing rich context and analytical depth. Our goal for you, the listener, is pretty straightforward. Gain knowledge swiftly but thoroughly, aiming for those aha moments that really stick.
Exactly. And to help us navigate this fascinating vocabulary, we've structured our deep dive logically. We'll start with essential nouns, then move into dynamic verbs, and finally round things out with some insightful adjectives. Our guiding principle here is really embracing nuance and demanding precision in language. Knowing the exact right word, well, it empowers discussions that are precise and facilitate crystal clear communication.
hmm And each term we've picked, it's from advanced lexical resources.
Yeah.
So that signals their critical role in sophisticated discourse.
Right.
What's truly fascinating, I think, is how a single word can open up entire new layers of understanding. We're aiming to move beyond just surface level stuff to genuine expertise. And you'll see how even familiar terms can carry surprising weight.
Okay, let's unpack this then. Our first noun, antiseptic. We kind of know it prevents infection on living tissue, but how does that key difference from a disinfectant, one for surfaces, play out in real-world health, both everyday and, well, critical situations?
That's a really crucial distinction. Think about your daily antiseptic mouthwash. It's not just a simple cleaner, right?
Right.
It's actually a micro battleground. It's actively inhibiting bacteria to prevent things like gingivitis. It's a proactive, personal layer of defense we often just take for granted.
So it's not just personal care then. I'm thinking about surgical settings. The stakes there must be incredibly high for this distinction between antiseptic and disinfectant.
Oh, absolutely. In surgery, applying an antiseptic solution to the site isn't just routine procedure. It's a foundational, potentially life-saving protocol. A tiny oversight could lead to severe post-operative infections. It really demonstrates how our most critical medical interventions rely on this fundamental principle of microbial control.
So antiseptics really reveal this ongoing sort of invisible war against microscopic threats. It's a testament to how modern health is built on these foundational, often unseen acts of prevention.
Exactly. Layers of protection.
Okay, shifting gears a bit. Let's explore a term that carries significant weight and often sparks wider conversations beyond the purely medical branch, abortion. It refers, of course, to the intentional ending of a pregnancy. Expert, how does the terminology around this term reflect differing perspectives?
Well, this is where language becomes incredibly sensitive. Synonyms like termination or induced miscarriage aren't just simple alternatives.
Right.
They reflect varied perspectives and often deeply held beliefs. How we actually phrase it truly shapes the conversation that follows.
Okay, so to illustrate that, let's think about how a medical team might use it. Like the medical team discuss the risks and benefits of abortion procedures with the patient.
That example really highlights its usage in clinical consultations. It underscores the paramount importance of informed decision-making in reproductive health and the ethical considerations that medical professionals and patients have to navigate. It's fundamentally about empowering choice through clear, respectful language.
This term really shows how language itself can be a kind of battleground, right? Especially when we look at the broader societal discussions around it.
Precisely. Within that broad sociopolitical framework, terms like rights, choices, life, personhood, these profoundly shape the debate itself.
Yeah.
As impartial observers, we have to note these are complex societal conversations, and the specific words chosen carry immense weight, often defining the very boundaries of the discussion.
So abortion teaches us that vocabulary isn't always neutral. It's often a mirror reflecting society's deepest values and the ongoing evolution of our collective conscience on these very sensitive topics.
Well said.
All right, let's talk about anesthetic. Now, this is a drug designed to make part or all of the body unable to feel pain. How does it differ from similar terms we hear, like analgesic or maybe sedative?
It's a good question. An anesthetic creates a complete loss of sensation, potentially even consciousness. An analgesic, on the other hand, reduces pain while you generally remain awake, think ibuprofen. And a sedative primarily induces calmness or sleep. So each has a really distinct primary effect.
So if I'm at the dentist getting a cavity filled and they give me that shot in my gum, what kind of anesthetic is that exactly?
That would be a local anesthetic.
Mm-hmm.
It's incredibly targeted. It blocks pain signals only in that defined area, allowing you to stay fully awake but feel no discomfort during the procedure. It's very focused pain control without systemic effects.
Got it. And for something much bigger, like a major surgery.
Then you're almost certainly looking at a general anesthetic. That induces full body insensitivity and unconsciousness. It ensures complete patient comfort and, importantly, safety during critical or lengthy invasive operations. It's really a cornerstone of modern medicine, fundamentally transforming surgical capabilities.
So anesthetic is really about tailoring the level of, well, unfeeling to the specific procedure, allowing medical interventions that would just be unbearable otherwise, from a simple dental procedure all the way to life-saving surgery.
Exactly. Tailored numbness.
Okay, our next noun takes us into the realm of genetics and emergency response, blood type. Beyond just matching donors for transfusions, what makes this classification so significant?
Well, many people might not realize its role in inheritance, actually. A child's blood type is determined by the combination of their parents' blood types.
Right.
It reveals these fascinating patterns of genetics. It's really a foundational piece of your biological identity.
But the real urgency, I guess, comes in emergencies. You hear donors must match the recipient's blood type to avoid transfusion reactions. What actually happens if there's a mismatch?
A mismatch can lead to severe, sometimes life-threatening adverse reactions. The immune system attacks the transfused blood cells.
Wow.
So this underscores its critical importance in emergency medicine. It's not just a preference. It's often a matter of life or death for safe blood transfers.
And looking ahead, it seems like it might have a role in personalized health, too. I've heard things about knowing your blood type being crucial for personalized medicine, maybe even diet recommendations.
That's an interesting and definitely emerging area. It points towards the future of personalized health. It hints at a time where individualized care might be increasingly guided by unique biological markers, like your specific blood type, potentially optimizing wellness in new ways.
So blood type, it's this tiny but mighty piece of our genetic puzzle, a fundamental biological identifier that influences everything from family traits to life-saving transfusions and maybe even the future of personalized wellness.
Precisely. Small label, big implications.
Now, let's talk about a principle that underpins, well, all ethical medical practice: informed consent. It's that permission given by a patient after being fully informed of all possible consequences and risks. How is this really foundational to modern healthcare?
Oh, it's absolutely foundational. You can't overstate it. Informed consent profoundly emphasizes patient autonomy, their right to make treatment choices. It places a clear moral obligation on healthcare providers to fully educate their patients. This allows for truly independent and self-determined decision-making.
So it's not just for deciding on a specific treatment then. It applies to research too, right? Like, researchers must obtain informed consent from participants before starting clinical trials.
Exactly. That highlights the legal and moral requirements for voluntary involvement in research. Participants absolutely must understand the nature, the purpose, potential benefits, and, very importantly, the risks involved in the study. It's about protecting individuals while still advancing science.
Right. And before surgery, it must be a critical discussion. I imagine the phrase, "the surgeon explained the procedure thoroughly to secure informed consent," happens all the time.
Absolutely. It depicts its crucial use in those preoperative discussions. It reinforces the patient's fundamental right to make a fully informed choice, stressing the need for comprehensive explanations of both the upsides and the potential downsides. It really frames it as a partnership, not just a procedure being done to someone.
So informed consent really isn't just about getting a signature on a form. It's this powerful principle that puts the patient's autonomy and understanding right at the very heart of healthcare. It transforms the dynamic into something truly collaborative.
Couldn't agree more. It empowers the patient.
Okay, we're transitioning from those essential nouns. Let's explore some crucial verbs now, the actions, the processes that define health practices. We're starting with to administer. It means to give someone medicine or drugs. Expert. What's maybe a common misconception about this verb?
Well, I think many might just think it means to give, plain and simple. But to administer carries this implication of precision, of responsibility.
Okay.
Synonyms like dispense or apply
Yeah.
hint that it's more structured professional context. It's really about ensuring the right substance is delivered correctly, often by someone trained to do so.
Can you give us an example of that precision in action?
Sure, think about nurses working in a hospital setting.
Yeah.
They administer medications according to precise schedules. This isn't just casually handing out pills, right?
Yeah.
It's a vital, routine application that stresses accuracy in dosage and, crucially, timing for optimal efficacy and, of course, patient safety.
And in really urgent situations, that precision must take on even more significance, like when paramedics administer first aid at accident scenes to stabilize victims.
Absolutely critical then. This highlights the urgent nature of immediate therapeutic actions. In an emergency, swift and effective administration of care done correctly can genuinely be life-saving. It's where that precision meets immediate high-stakes impact.
So to administer is really the action that brings medical theory into practice, directly impacting health outcomes through that combination of precision and responsibility.
Exactly. It's the doing part of care.
Okay, now to diagnose. This means finding out the cause of a problem or disease by carefully examining symptoms. I like your earlier thought. It's like being a health detective.
Yeah, that's a great analogy, isn't it? It really captures the investigative and analytical nature of the process. Synonyms like to identify or to detect underscore this problem-solving aspect. You're looking for clues.
And where does that detective work typically begin?
Well, it nearly always starts with symptom-based analysis.
Right.
Whether it's your GP or a specialist, those observable symptoms, what the patient reports, that's the absolute foundation of the initial medical assessment. It guides all the further investigation.
How has technology changed that detective work over the years?
Oh, tremendously. Advanced imaging techniques, things like MRIs, CT scans, ultrasounds, they've revolutionized how we diagnose internal injuries or conditions.
Right.
They significantly enhance the precision and accuracy, allowing doctors to literally see what was once completely hidden or only guessable.
So to diagnose really is the Sherlock Holmes of medicine. It's about solving that health puzzle, finding the cause. It's the vital first step that directs all the subsequent treatment, unraveling the mystery of illness.
Precisely. You need the diagnosis before the cure.
Next up, to vaccinate. This means protecting a person or an animal against a disease by giving them a preventive shot that stimulates their immune system. What makes this such a powerful public health tool, would you say?
Well, it's truly a cornerstone of preventative medicine. You can't really overstate its impact. Synonyms like inoculate or immunize emphasize building that crucial immune response. It's all about foresight preventing illness before it even starts.
We certainly saw the global impact recently, but it's also a collective effort on a smaller scale, too, isn't it? Like when schools require students to vaccinate before enrollment to maintain herd immunity.
Precisely. That highlights the collective protection that widespread vaccinations provide for the entire community. It's almost like a social contract of health, where individual action contributes directly to broader safety, significantly reducing disease transmission for everyone, especially the vulnerable.
And it extends beyond just humans into agricultural health, too.
Oh, absolutely. Veterinarians regularly vaccinate livestock to control outbreaks on farms. This plays a crucial role not just in managing animal health, but also in safeguarding our food supply chains and preventing widespread economic impact from animal diseases.
So to vaccinate is kind of the ultimate proactive defense, a really powerful verb that speaks to foresight, scientific achievement, and that collective commitment to turning potential pandemics or even just common illnesses into preventable ailments.
Exactly. Science in action for prevention.
Our next verb is to stitch. This means joining the edges of a wound together using a thread and needle. Beyond the obvious physical action, what does this verb truly represent in medicine?
Well, to stitch, or the more formal medical term suture, really represents precise repair. It's about carefully bringing tissues together to facilitate proper and effective healing. And, crucially, often preventing further contamination or infection.
Right, and it's not always just about closing a wound functionally. It can be something of an art form, can it? Like when plastic surgeons stitch incisions meticulously to minimize scarring.
Absolutely. There's definitely artistry involved there. That emphasizes the extraordinary precision and, yes, artistic skill required in plastic surgery to achieve optimal aesthetic outcomes, turning a necessary repair into something that looks as good as possible afterwards.
I can imagine in emergency situations, out in the field maybe, this skill is critical.
Without a doubt, emergency medics will often stitch lacerations in the field when possible. This kind of rapid medical action helps control bleeding and stabilize injuries right there at the scene, sometimes literally saving a limb or even a life before they can get to a hospital.
So, to stitch is about much more than just sewing skin. It's about precise repair, minimizing damage, and really setting the stage for optimal healing. It demonstrates how crucial manual dexterity is in medicine.
Foundational skill, absolutely.
Okay, our final verb for this segment is to soothe. It means to reduce the severity of pain or discomfort, bringing comfort and relief. What's a simple, everyday example of this?
A classic one is, the cold compress soothes the pain and reduces swelling after a sprain or bump.
Yeah.
Simple, non-invasive remedies like that can effectively reduce inflammation, ease discomfort, and provide that sense of immediate relief we often seek.
And it's not always about physical pain, is it? How does to soothe apply psychologically?
That's a really fascinating application. For instance, music therapy soothes anxiety in hospital patients. This explores those profound psychological approaches, linking auditory stimuli, like calming music, to the reduction of pain perception and anxiety, even in a clinical setting. It really showcases the mind's profound influence on our experience of healing and comfort.
So, whether it's a cold compress on a twisted ankle or the calming effect of music therapy in a stressful environment, to soothe reminds us that healing isn't always about aggressive intervention. It often encompasses the holistic nature of care, extending beyond just physical symptoms to our emotional and psychological states, too.
Precisely. Comfort is a key part of recovery.
Okay, we've navigated nouns and verbs. Now let's round out our deep dive with some key adjectives. We're starting with one that needs careful handling. Dumb. Historically, this primarily meant unable to speak. Expert. Why is understanding the history of this particular word so important?
It's really crucial because its usage has evolved considerably, and honestly, it can be quite offensive now it's used incorrectly to mean lacking intelligence.
Right.
Historically, mute or speechless are the current, more respectful synonyms for being unable to speak. But yes, dumb was commonly used to describe individuals with speech impairments. Disability discourse has, thankfully, moved far beyond that terminology.
So context is absolutely everything here. What about its use describing an acute emotional response, like trauma can leave survivors temporarily dumb from shock?
That's a valid, though less common usage today. It illustrates how profound shock or extreme fear can temporarily render individuals speechless. It's a powerful physiological manifestation of intense psychological impact, highlighting how emotional distress can literally override our ability to communicate verbally for a time.
So dumb in its historical context and evolution is a powerful reminder of how language reflects our understanding of human conditions, and how that understanding changes over time, underscoring the importance of historical context, cultural context, and of course, sensitivity.
Absolutely. Language evolves, and we need to evolve with it.
Next, pharmaceutical. This is an adjective directly related to the production, use, or sale of medicines. Expert, what would you say is the most significant aspect of the pharmaceutical industry today?
Oh, without a doubt, I'd say the sheer scale of industrial innovation. You hear how pharmaceutical companies invest heavily in research for new therapies. This underscores the substantial financial investment and the continuous, relentless innovation required in drug discovery and development. It really forms the backbone of modern medicine development.
And what about its role in conventional treatments? Like, doctors often prescribe pharmaceutical interventions to manage various medical conditions.
Yes, that's standard practice, isn't it? Pharmaceutical interventions are absolutely central and, frankly, indispensable in managing a huge array of medical conditions, from chronic illnesses like diabetes or heart disease to acute infections. They're the backbone of most conventional treatments worldwide.
So from those massive R&D budgets all the way down to a doctor writing a prescription, pharmaceutical defines an entire ecosystem, a vast and intricate domain, constantly balancing that drive for innovation with stringent safety protocols to impact global health directly.
A very complex world indeed.
Now, the adjective deaf. It describes someone who is partly or completely unable to hear. Expert, what's an important nuance to understand with this term?
I think it's really crucial to understand that deaf, spelled with a capital D, often refers to a cultural identity. It encompasses a community that shares sign language like ASL or BSL and has distinct social norms. Whereas hearing impaired or hard of hearing are more general terms describing the level of auditory impairment, often used in a more medical context. The cultural distinction is key for many.
And regarding adaptation strategies, it often involves incredible resourcefulness, doesn't it? For
Yeah.
example, he learned to lip read to better understand conversations as he grew deaf.
That powerfully showcases adaptation strategies, yes. Individuals often develop remarkable compensatory communication aids and skills, like lip reading or mastering sign language, to navigate progressive or congenital hearing loss. It demonstrates incredible resilience and ingenuity.
What about from a public health perspective?
Well, a key point is that some forms are preventable. Noise-induced deafness is preventable with ear protection.
Mm.
This ties the term directly to occupational health and even recreational noise exposure. It stresses the preventable nature of certain types of auditory loss and the crucial importance of using protective measures consistently in noisy environments.
So, deaf speaks to a whole spectrum of experience. It's a reminder that disability isn't just a medical condition, it's often a lived experience with rich cultural dimensions, highlighting environmental and societal factors as much as the physical state.
Exactly. It prompts thinking about the social model of disability.
Okay, finally, our last adjective sighted. It simply means capable of seeing, typically used in contrast with someone who is blind. Expert. How does this core human sense impact our daily lives in ways we might not always consciously consider?
Well, it's really the foundational sense for so much of our interaction with the environment and increasingly with technology. Think about it in terms of vigilance or awareness. An old example maybe, but the lookout sighted enemy ships approaching the harbor and raised the alarm.
Right.
It highlights that essential role of visual capabilities in surveillance and detection, which is still relevant today in security, navigation, and many other fields.
It also plays a vital role in inclusivity and support, doesn't it? Like sighted guides assist visually impaired individuals in navigation.
Exactly. That promotes inclusivity and highlights the vital support role. It points to the collaborative roles that sighted individuals can play in enabling navigation, describing environments, and enhancing the daily lives of those with visual impairments, fostering independence and participation.
And modern technology often relies heavily on it, right?
Oh, absolutely. Think about virtual reality simulates experiences for sighted users in training. Visual capabilities are fundamental to how users interact with and benefit from sophisticated simulations, whether it's for pilot training, surgical practice, or even just entertainment.
So sighted defines this core human sense and its vast implications. It's fundamentally about how we perceive our world from basic observation to complex technological interaction and how that perception shapes our interaction with everything around us.
Our primary window on the world for most.
Wow, what a journey that was through these specialized health terms. We've truly taken a deep dive today, haven't we?
We certainly have.
Our aim wasn't just to, rattle off definitions. It was to really understand the contextual usage and the nuanced meaning behind each word, hopefully equipping you for more sophisticated conversations and deeper comprehension in the whole world of health.
Absolutely.
Yeah.
And mastering this kind of lexicon doesn't just bolster your C1 level proficiency on paper. It genuinely prepares you for advanced discussions across medical, wellness, and psychological domains. The depth of understanding you've hopefully gained today goes far beyond just rote memorization. It's about achieving genuine insight and realizing the power that precise language brings to these important topics.
Yeah, and as you go about your day, maybe think about how the precision of these words, just the act of knowing the right term for the right context, doesn't just improve your own communication, but maybe how it shapes our broader understanding of things like health policy, patient advocacy, or even our personal well-being.
That's a great point. How does language truly empower us in the realm of health, both personally and maybe even globally? Something to ponder, perhaps, as you continue your own deep dives into the world around you.